donation and transplantation. So over to you.
Thank you very much. Namaskar, good morning. Greetings from J&K. So it's a new organization as far as J&K is concerned, established in 2019, September. In Super Specialty Hospital, Government Medical College, Jammu, it was established. So this is the budget condition for last 3 years, as we have been asked for to present it. Regarding remuneration, we have utilized 99.9%. And IEC activity is 88.2% for the last 3 years. Next slide. So current manpower, we have full manpower, joint director, consultant, IEC media, transplant coordinator, program assistant, and 2 drivers. Not through outsourcing, we have 2 regular contractual drivers. And regarding facilities in SOTTO, the whole area is around 400 square feet in the GMC, and we have 2 rooms which are centrally air conditioned. We have a training facility in the hospital, not in SOTTO. So website we don't have. Total number of registered hospitals of the state linked with NOTTO, we have 5 hospitals. And there is a SOTTO steering committee which is functional. Regarding healthcare infrastructure, we have 3 kidney transplant centers conducting live kidney donations and transplants. These are GMC Jammu, GMC Srinagar, and Scheme Srinagar. Scheme Srinagar is the oldest transplant center, kidney transplant center, working for last 20 years. Then we have 6 corneal transplant centers: GMC Jammu, GMC Srinagar, Northern Command Hospital, Udhampur, ECRC Srinagar, and SSH AV Srinagar. First 3 with cornea banks. Corneal donations are happening in Jammu region. Srinagar centers are procuring cornea from outside the UT. This is the status. Then we have 1 organ retrieval center in Northern Command Hospital, Udhampur. Still retrieval is yet to start. Then only GMC Jammu has a working brainstem death committee, duly approved by the appropriate authority. We had 19 suspected brain dead patients in 2023, and 2 were certified by the brainstem death committee. Unfortunately, no donation happened. And this year also we had 3 certified brain dead persons, but no donation till date. Recently, 2 nurses were posted as a full-time transplant coordinators for conducting organ donation in GMC Jammu. The rest of hospitals have yet to identify for this purpose. Dedicated ICUs, Jammu GMC has 4, GMC Srinagar has 5, Schemes has 4, Northern Command has 1. Now regarding appropriate authority, till recently we had DGHS as an appropriate authority, but now the divisional appropriate authorities are there. 1 in Jammu and 1 in Kashmir, and the respective health directors are the conveners. So, compliance indicators, we have yet to start the monthly reporting of brainstem death certification data, and we have circulated the communication received from the NOTTO to all these hospitals, transplant hospitals. And we will be doing that soon. And as I told, total number of brain stem death cases certified were 2 last year, and number of patients in the waiting list registered on NOTTO website are 31. These are for kidneys. And monthly data we are sharing with the NOTTO online, and we have 8 transplant coordinators in the registered hospitals in J&K. And number of organ and tissue distributable hospitals, tissue banks registered in NOTTO are 5. So these are the statistics about corneal transplants. Last year we conducted 41 organ transplants. Previous to that, 21, and this year 5. And kidneys, last year we conducted 51, but all these are live transplants. And this year we have conducted 14, and 2 years back we had 53. So these are the key activities from beginning to till date. Number of transplant coordinators trained in 21 we trained 1 transplant coordinator, 22 1 transplant coordinator, and 23 2. Then number of CMEs we could not conduct any. Number of intensivists and surgeon trained. In 22 we trained 1 urologist, 1 anesthesiologist, and 2 urologists, thanks to 2 pathologists. Sorry. Thanks to ROTTO and PGH and here, they were trained here. And in the year 2023, we trained 1 neurosurgeon and 1 anesthesiologist at AIMS. It was a short-term training there. And in-house training we conducted in SOTTO specialty hospitals in our SOTTO. 10 nurses, 5 transplant coordinators, 2 medical social workers. Then the number of IC, we are conducting a good number of IC activities. We have a good team in SOTTO. Total till date we have conducted 261 IC activities. The year 19, only 3, 2010, gradually we increased, 21 we conducted 35, 22, 61, 23, 115, and this year till March we conducted 37. We are also active on social media posts, Facebook 410, Twitter 2313, posts and retweets, and Instagram 410. These are the meetings we conducted regarding organ donation. So, in 21, 1 meeting was conducted, 22, 14, in 23 we conducted 15 meetings in Jammu as well as Srinagar. Then Green Card Road meetings we conducted 5 in 22, and last year 2. Webinars we conducted for organ donation, 2 in 22 and 1 in 23. So some of the practices we conducted, we had a roadside wall painting on organ donation under Smart City project. We could do it. Collaboration with other departments regarding organ donation. We have collaborated with tourism department. They are conducting various melas and festivals, and we are given a space there to create the awareness, pledging and all. Then media coverage we are doing. TV and media interviews on organ donation. We have conducted 800 plus pledges online, and offline we had conducted more than 2,000 previously. Also we release annual newsletter. This year we are coming up with the 2nd edition. We call it Naman. And we organized competitive events among nursing students of J&K in Jammu as well as in Kashmir. Then SOPs we developed for organ donation and transport through green corridor. It was a new subject. We created SOPs for all to note. Then we also conducted marathons on organ donation theme in Jammu as well as in Srinagar. So these are some of the events. These are marathons. Issues and challenges, as everybody knows that we also have those myths and misconceptions in the society. We are trying to overcome that. But some of more challenges and issues we have in Jammu division after conducting various workshops with brain stem declaration and organ donation for the faculty, including deliberation on starting cadaveric organ donation in GMC Jammu by Dr. Vipin, our nodal officer, ROTTO. Brain stem certification is being done, but with no donation till date. In Kashmir division, we are facing difficulties. Cadaveric donation has not been initiated due to the lack of brain stem death committee. It has not been formed, despite having many workshops and seminars on organ donation and brain stem declaration. The big challenge is the budget. We are not getting timely release of budget for SOTTO to activate my staff. budget is delayed every year, and with no salary to SOTTO staff and inadequate IC, 4-hour funds, adequate funds are required for movement in the Kashmir division. Another issue is new pay scales. New salary of 2021 is being given to fresh recruits, whereas the existing staff who has worked so hard for establishing SOTTO in J&K is still working with old salary, and this has been leading to discontent. Leave rules, we don't have a clear-cut leave rules for the SOTTO staff. This has led to loss of salary in case of any leave other than the casual leave we take. The way forward is to start disease donation in J&K, including organ donation in Kashmir division, the registration of new medical colleges as organ retrieval centers. And our suggestions remain same. The leave rules should be notified for SOTTO. Uniform salary as per new guidelines to be implemented for all ROTTOs and SOTTOs. These are the media handles, and thank you very much for taking this.
We will have, if anyone has, behind the schedule. So, anyone has any questions? So,
I think it is very applaudable that the states of J&K and Himachal and even Rohtak, they have shown so much initiative they have taken, and it's been seen that we are going to be ahead of these things in the near future. The next conference will definitely see some more milestones, and we are very appreciative of the efforts being taken, and the challenges are uniform only. I think the solutions will also be uniform. With that, I think Pankaj.
I think the challenges that ma'am has already mentioned are uniform, the administrative challenges and all. I think these workshops are important because what has been brought out is that the inertia amongst the doctor fraternity as far as the brainstem death is concerned, and ma'am has taken so much initiative in PGI to maintain those patients who are undergoing that process. I think somehow that inertia has to be overcome, and these workshops are very, very relevant to continuously hammer the point. With this,
Rest of time, we can always have questions during lunch session. Thank you very much, all the speakers.